So this is an excellent question. I've been waiting for this one. So core role and responsibilities of an acute care nurse practitioner, an adult gerontology acute care nurse practitioner such as myself, we serve populations of young, middle, older adults in critical care or acute settings. And so critical care is my background. So it was one of the major motivating factors as to why I became an acute care nurse practitioner. Also, acute care nurse practitioners aren't limited to just in-hospital settings. So that was a major motivating factor as well. I'm able to work in an outpatient setting as well as a hospital setting, or even in a community setting as well, such as rehabs, and home health, things of that nature. So I'm not limited, such as with primary care or FNP, or like emergency room specialized nurse practitioners. So just to get more into the actual role and responsibilities of an acute care nurse, we are able to provide direct patient care from admission to discharge to patients in acute and critical care settings. We're able to order and interpret diagnostic testings. We're able to do a lot of invasive procedures, which I love. We're able to do lumbar punctures, central line catheters, chest tube insertions, bone marrow biopsies, arterial line insertions. We're able to prescribe medications. The role is very, very diverse. And so I really appreciate the fact that I have a lot of autonomy under the umbrella of this role. I am also able to just be a part of an interdisciplinary team that includes physicians, other APPs such as physician assistants, and coordinating care for our specialized patient population. So those are literally just like the bare bones of what an acute care nurse practitioner can do, like what our role and responsibilities include. I know acute care NPs who are completely removed from the bedside and are device management specialists. So I'm not sure if you're familiar with devices such as like ECMO machines, LVADs, ProTech catheters, things of that nature. I have a lot of NP friends who are device management specialists, and they travel to hospitals in their area, and they have very lucrative careers and flexible schedules and good pay. So that was just the bare description of what an acute care nurse practitioner can do. But if you have more questions, please click on the link that I'm going to share that will direct you to an article on Nurse.org's website. So my journey from an LPN to an NP took me about 11 years. I literally just recently shared a post on my personal page about what it took for me to go from an LPN to an NP. But basically, I became an LPN in high school. I went to a high school in Chicago, Illinois that allowed me to graduate with my LPN license. I then went directly to undergraduate, where I completed 5 years of undergraduate, obtained my BSN, and then from there, I took about a 3-year break and worked as an RN in an acute care setting. And then I enrolled into an accredited graduate program, an acute care nurse practitioner graduate program. And it took me 3 years to complete that degree. And so that gave me a grand total of about 11 years going from LPN to acute care NP. Pulmonary didn't discuss that with me. Let me know about that, okay?